everybody, welcome to my talk today on appraisals for registered nurses and nursing associates. I'm going to provide an overview of appraisals and some practical tips to help you prepare for an appraisal, and that's also for people who are appraising somebody for the first time as well. There's lots of tips for you as well. So this is part of my nurse education series on my YouTube channel, Support and Career Development for Nurses. Do give me a thumbs up if you enjoyed the video, and if you subscribe you can have notifications for future videos. They're all free on my YouTube channel. So I hope you enjoyed the session today. So what is an appraisal? An appraisal is the act of making a judgment about somebody or something, and healthcare regulators such as the Care Quality Commission, the CQC and the Department of Health advocate that all healthcare employers should provide an annual appraisal for their staff, as it's deemed essential for promoting high quality care. The person conducting your appraisal is called an appraiser, and the person being appraised is called the appraisee. And once you secure a date for your annual appraisal, you should prepare well in advance to gain the best out of it. And an appraisal is a chance for you to receive constructive feedback and support from your manager to enable you to thrive in your role. And it is not the correct place for a manager to deal with disciplinary procedures. During your career, you're going to require ongoing feedback from your line manager in an annual appraisal, and that's where your professional development and progression is evaluated, and it relates to your specific role with that employer. Your appraisal is informed by preceding professional development reviews, PDRs, and professional development plans going forward. And I have a video, a simple overview of preparing for professional development reviews that are in between your annual appraisals if you're interested. Structuring an appraisal. So appraisals are based on evaluations of your learning goals, your objectives and role-specific competencies. And new goals and objectives are set for the next year with your employer, your line manager usually. And there's usually three parts or three areas to an appraisal. There's the review of your progress and achievements over the last year, and then there's some setting of future objectives that are aligned to your specific role, and then there's planning your professional development and education and career development with your professional development plan for the next year. So looking at frameworks for the documentation, there's a variety of frameworks and headings on appraisal documentation dependent on the UK employer. So some local frameworks will align to the quality priorities of that employer. They may link to competency frameworks or job descriptors, the NHS knowledge and skills framework or NMC code themes. And so do check out the framework of documentation and how you will be appraised. The format of your appraisal will relate to that framework. So some of the example topics that might be discussed, so you're a bit prepared in your appraisal: how your role relates to the team and the organisation, personal and professional development over the last year, and your current knowledge and skills in line with the requirement of the role, so your competence and performance relating to your job description. If you're newly registered, you may have some newly registered nurse or trainee nursing associate competencies, for example. Key achievements using previously set role specific objectives. So if you're a more experienced nurse or nursing associate, you'll have set specific objectives from the previous years. So they'll be looking at that and your key achievements in those areas. Education and training opportunities available over the next year, and any additional support that you feel that you need to access over the next year. Future career progression, and there'll be some setting of future objectives in the latter part of your appraisal, where you'll be looking at professional development plans for the next year coming. So the overall purpose of an appraisal, in my opinion, is to ensure that you're happy and progressing well in your role, and that's what the appraiser should be aiming to achieve. You've got an opportunity of a two-way conversation with your line manager to review your achievements, any challenges or barriers in your role, and the expectations in your role for the next year. To inform, agree future professional development plans. So once you've done that review, you're looking to the future on those professional development plans going forward, and is there any additional support or education required in the future? And just to note, educational funding, many employers will ask that you register any requests for courses and study days or conference days in an appraisal as part of a review of whether you should get the funding or the leave for that. So do check out what the policy is in your employer. And also they may want you to have it registered in preceding professional development reviews as well. So who's going to conduct my appraisal? Usually your line manager, and it should take place annually, as I mentioned before, with the professional development reviews in between. And the professional development reviews will be as required, but when you're newly registered, your preceptorship period, they should be quarterly, sort of every 3 months. Your preceptor and your clinical educator may attend, especially if you're in your preceptorship period, to help provide the feedback on your progress, but not always. Sometimes it's just your line manager, and they'll review previous professional development reviews from your preceptor or clinical educator. It may also be multi-professional depending on your role. So some nurse researchers, advanced nurse practitioners will have different disciplines in depending on the research project and your role. So what else to expect? An appraisal should always be documented, and the documentation may be paper, but the majority of employers nowadays are using online appraisals, and it should be face to face. It could be virtual if both parties are happy with that. However, even if it's virtual, it should always be confidential in a closed room to allow the person to feel safe and to open up in that and maintain that confidentiality. The appraiser should always use a supportive and constructive approach, and it's really not appropriate for a line manager to performance manage a staff member in an appraisal. Appraiser feedback, it will feedback on your progress over the last year, and that will align to your job description and role specific competencies or proficiencies. And at the end of your appraisal, you will have mutually agreed objectives and goals that should align with local, professional, strategic and employer requirements. Your manager should always include your views, so it's a two-way conversation in that appraisal. It should not be one-way conversation. However, when you're newly registered, it may be that you're going to be led more by the appraiser, which is sort of a more natural, because you've never had an appraisal before, for example. But it should be two-way conversation, and both parties should agree those objectives, the expected outcomes and future support and training required over the next year. Once completed, your appraisal should be signed off by both people, and the appraiser and the appraisee, and you should always have a copy that you can keep for yourself, either online or a paper copy. And it's very important that you record your appraisal documentation for accuracy in future appraisals, because sometimes line managers might leave and the next line managers might say, right, have you got a copy of your appraisal? And also to support course applications. But if anything happened at work and somebody thought that you weren't performing, somebody said that, you know, there's a performance issue here, you need that documentation in any performance reviews. Your line manager or deputy should conduct your annual appraisal, and looking as a new starter, new starters will receive an orientation and induction first, an orientation to the area, and then you've got your preceptorship period, your ongoing professional development reviews, and then your appraisal after your first year. And I have got a talk on AIMS, a video on AIMS objectives and SMART goals that you might find helpful, linked to the professional development review video that I recently uploaded. When you first start in a role, you should ideally have professional development reviews at 3, 6, 9 and 12 months. That's the gold standard linked to to preceptorship, and that will lead to that 12-month appraisal. Minimum, I would say, is 6 monthly reviews. After you are established in a role, you should then negotiate those professional development reviews as and when needed. So how do I prepare for an appraisal? And this is for the person being appraised, and also for the appraiser, the person who is leading the appraisal. So advice for the person conducting the appraisal, the appraiser first of all. If it's your first time, familiarise yourself with the documentation and the appraisal structure. And sometimes employers change that structure, even if you've been an experienced appraiser. So have a look at it before you start the appraisal. Try and review what opportunities are available for the person that you're going to be appraising before the appraisal. Are there any study days, e-courses, apprenticeships, academic courses or learning opportunities? There might be research scholarships or fellowships that could support this person. And then look at how feasible it is to offer study days or study leave or other options. And that's because you might be asked by that person what release of study day would be available, and you need to be equitable across the team. So if you're not quite sure, you might need to ask a manager or have a look at rotas, for example. Start with open questions. Always start with being approachable, open questions coming from their perspective. How have you been this last year, and explore their perceptions, their progress, their achievements, and their support from them and their perception first. Achievements should always be recognised, giving positive, feedback, and always start with the positives and the progress made before you start looking and focusing down on any areas for development. But you can do that really constructively with constructive feedback. So think about your language, areas for development, rather than, well, things you're not doing very well at the moment, because that sets a negative tone and it's not constructive. Everybody has areas, I have areas for development and I have weaker areas. But so ending positively with an agreed action plan for the year is much more likely if you're setting a sort of constructive tone to the appraisal. What appraisals shouldn't be is you should never ever discuss disciplinary issues during an appraisal. It's not appropriate. It is for your aim really is to really constructively be looking at the person's support, their progression, and what we can do as an employer and as a line manager to support that person to thrive in their role. And discussing disciplinary issues, time should be set aside separately in a performance meeting to discuss serious performance issues, and you need to adhere to local performance and conduct policy. So the appraisee now, the person who is having an appraisal. So prior to your appraisal, be proactive, book your appraisal when in advance of your due date, and check how your appraiser prefers to book them. So you need to find out who's appraising you and how you book them. And I would do that 3 months, so at 9 months prior to your 12-month annual review. Book your appraisal and send a calendar invitation, because people that are doing appraisals may have lots and lots of appraisals to do, and so being proactive, they'll really appreciate that you're being proactive as well. What you might find is some appraisers will do that in advance for you, but I always think it's good to be proactive and send an email. Never worry if it's your first time having an appraisal with that person. They should lead you through local structures, but it's helpful to familiarise yourself with the appraisal template before the meeting. Usually there's going to be 2 comments box in an appraisal, one for you to put your feedback and one for the appraiser. And sometimes appraisal documentation will ask you to do reflections and to do some comments before the appraisal. And it's really time consuming for an appraiser if you haven't done your comments, if your employer requests them beforehand. And I know appraisers who will say, I'm not going to appraise you today because you haven't filled in your documentation. So do check what is expected. Prior to your appraisal, it's really helpful to think about some of these areas. So having a look at the job descriptors, any previous objectives and goals. If you're newly registered, have a look at the orientation documentation and induction documentation and your competencies or proficiencies, and review how you think you've progressed and reflect on that. Reflect on how your role relates to the team. What have you achieved since the last appraisal? What are you really proud of? And it doesn't have to be something like a service improvement project. It can be a patient that you've cared for, that you'd cared for that patient really well and made a difference to them. What additional support or training opportunities will help you progress? What are you interested in relating to the area? What are you interested in developing and influencing in practice? And what should be your objectives and development plans for the next year? What do you think they should be? Also, reflecting on your achievements over the last year and how you overcame struggles is very helpful to reflect on, and your career journey to date. Thinking about going forward, which roles, courses, career pathways suit your interests, skills, your strengths, and what are your aspirations? Because you have this annual appraisal and you can use that opportunity to access support and courses. So be proactive is my key tip. What support and courses would help you in your role going forward over the next year so they can be documented in the appraisal? It's important to think about how you are going to influence practice in your area. You are much more likely to be offered funding for study days, courses, conference, if you align your request to the role, the service, the employer, the patient. How are you going to have an impact on patient care or on that service? So try to see it from your manager's perspective, because if every single person requests courses, they, on the same days, they do not have an unlimited amount of resources in time. They've got to ensure that the time and money, finances, so they have to ensure that their service and the patients are supported and their service is maintained, and they will prioritise funding. So seeing it from the manager's perspective and how will that course influence practice and improve care, you are more likely to get funding. Another key tip, identify the details of those training and academic courses before your appraisal. You might be asked, you've got that opportunity with your line manager who will be obviously very busy, and you've got an opportunity and they may say, well, what courses, where are you wanting to do these courses? How much do they cost? How many study days? And having the details prior to the appraisal is very helpful. So looking at the costs incurred and also having a look around. So some courses may be cheaper online or with certain universities. So having a look at, so you've got some choice there if possible. So establish which courses are funded by your employer through your education leads or your clinical educators if you have those roles. And also you might be able to access external funding. Now, if you're looking to access external funding for fellowships, scholarships, for academic courses through charities or through research, national research or Department of Health research, the National Institute for Health Research, for example, you can access, maybe you might be able to secure some funding, but you may also need study days to attend courses. So having this detail is very helpful. And if you cannot access funding locally, look externally. Find out how to formally request and apply for post-registration courses, funding and paid study leave as well. I have got some really helpful videos on post-registration nursing courses in the UK, how to get funding for UK post-registration nursing courses that talks through external funding streams as well, and then some top tips for securing funding. And if you're looking at research, some different research roles and how to become a nurse researcher, I always also talk about the difference between fellowships, scholarships, etc. In the UK as well. That's especially helpful for internationally educated nurses as well. And I've also got a video on if you're preparing for an interview for a course, because course funding may be competitive and an employer or a scholarship, fellowship, they will potentially have an interview that you have to attend to apply for funding as well. Looking at reviewing career pathways, I've got some helpful videos on how to become a UK charge nurse or nursing sister, senior nurse, different nurse educator roles, and how to become a specialist nurse or advanced nurse practitioner, and a helpful video on the 4 pillars of advanced practice. So during your appraisal, it's easy to forget what's being discussed in appraisal, and you might want to make some notes and bring a little notebook in as well. You complete an online appraisal template potentially as you go along or afterwards. Your achievements will be reviewed over the previous year using related measures, and I talked about those earlier, to summarise your progression, and professional development and competence will be reviewed using those key measures such as competencies, development goals, professional development plans. Constructive feedback, it should be two-way communication, which is essential, but you should always have an opportunity to give your perspective and discuss areas where you require extra support. You might not achieve those goals due to a lack of opportunity or support, and an appraisal is an opportunity and forum for you to discuss reasons for this. So managers should be trained to appraise you and to give constructive feedback and support you with any challenges, and listen, and you in turn should be listening and receiving feedback as well to develop your future knowledge and skills. So similar to where you have, if you were a nursing student or trainee nursing associate, you would have constructive feedback. There's always something we can learn from. Even now I have appraisals, and there'll be areas for me to develop and to going forward in the future. So what if you don't agree with your appraisal feedback? And it can happen. If you don't agree, you should always constructively state why and offer your appraiser factual examples to demonstrate your points and support your perspective. And this really shows the importance of preparation. By reviewing your previous goals, your plans, your objectives, you're going to be prepared to answer a question on this. If you cannot come to a resolution and you feel really uncomfortable about the appraisal and the way it was handled, you can talk to a human resources consultant confidentially. They have to offer confidential advice. You can talk to a freedom to speak up guardian. If not resolved, you can escalate to a relevant manager above that line manager, or talk to a union representative for confidential advice and some strategies going forward. But it's very rare it happens, because appraisals should be a constructive feedback approach that's two-way. We also have personal issues, all of us do outside work, and sometimes personal issues such as a divorce, a bereavement or ill health may impact on our performance, and some people are really comfortable talking about that in appraisal. Some people aren't. It could be very personal to you and you don't want to bring it up in an appraisal. Most managers are experienced at supporting staff through difficult times, and they might be able to signpost you to bereavement counsellor, for example, but it's very much up to you and dependent on you and what you feel comfortable with. So if you're struggling, you might want to discuss those issues, but you don't have to. And I do have a video on support available for newly registered nurses and nursing associate that signposts some support there as well. So signing off your documentation is essential. Once all sections within your appraisal form are completed, your appraisal can then be signed off. So it should never be signed off by both parties and then added to. Signing off the appraisal indicates that both parties have read the content and reviewed the other person's views. Sometimes what happens is in the appraisal, you might want some time to think about your goals, and the appraiser might say, go away, have a reflect, think about it, and then put your comments in, and then I'll sign off later, which is absolutely fine if you're both happy with that. Others prefer to do the whole process in one go and to sign off, but never sign off your appraisal without stating your views in the comment section, or if you're unhappy, then ensure that your perspective is documented still, in there. So don't be afraid to document. And sometimes, you might not come to a resolution. Ideally you will, and it's very rare this happens, but you don't feel that you've got to sign off, yes, this is fine, if you don't feel comfortable with it. So key tips to get the most out of your appraisal preparation. Prepare thoroughly in advance, be proactive, review those courses and learning opportunities available to you before your appraisal. Think about how you're going to benefit the patient, the staff, the service with those opportunities. And remember, having an appraisal should be a positive experience. It's a time to sit down, to gain some feedback, constructive feedback. Usually it's really, it's really nice to be with your line manager and to get some feedback on your progression. So I hope you found the talk helpful. If you've got any questions, do put them in the YouTube comments, or you can DM me on my website, Twitter or Instagram accounts. I have 2 books out and the links are in the description as well if you're interested. How to prepare for interviews and develop your career as a nurse or midwife, and how to thrive as a newly qualified nurse. So I wish you luck with your future appraisals.